Today's topic is the spleen. We are going to see about the spleen detailedly, and it is also one of the organ in the abdomen. So first, in the introductory part, we have to mention about the function of it. So spleen mainly involves in the immunity by providing the immunoglobulin M, and it also involves in the production of the RBC in the fetal life. In the adult life, the spleen acts as a graveyard of RBC, where the destruction of the RBC takes place. So, and it is also involved in the storage of the RBC, and it is released into the circulation when it is required. Coming to the location, first we have to say about the abdominal regions where it is located in the abdomen. So as we know, the abdomen consists of 9 regions. In that particular 9 regions, the spleen occupies the left hypochondrium. It is actually the spleen organ is presented on the left side, so it occupies the left hypochondrium. So in the abdominal regions, spleen is located in the left hypochondrium, and it is also associated with the ribs. Okay, so it is presented opposite to the 9th, 10th and 11th ribs. And it is so first we saw the abdominal regions where it is located. Second, the ribs. What are these ribs is related to the spleen. And third, the organ surrounding the spleen. It is presented between the fundus of the stomach and the diaphragm. So according to the location of the spleen, we have to speak about 3 things. First, in the abdominal region where it is located. Second, to which ribs it is associated. And third, to the visceral organs around it where it is presented. So all these includes the location of the spleen. Coming to the shape of the spleen, it is wedged shape, tetrahedral and triangular. So most of the population contains wedge-shaped spleen. Okay, so these are the different shapes in spleen. This is the most commonly occurring spleen, that is wedge-shaped, and this is tetrahedral, and this is triangle. Normally, in spleen, the visceral organ which is related is stomach and kidney. If sometimes the colon is also related. So all these are the different shapes of the spleen. Coming to the measurement. Normally the measurement of spleen is given by the Harris dictum odd numbers. Odd numbers in the sense 9, 1, 3, 5, 7, 9, 11. So 1 is the thickness, 3 is the breadth, 5 is the length and 7 is the weight. 9 to 11 ribs. It is associated with the 9th, 10th and 11th ribs. So normally the length will be more less, so we have to remember it as thickness will be smaller than the breadth. The breadth will be smaller than the length. So likewise you have to write, and the Harris dictum is used here. That is the main thing. And coming to the external features of the spleen, there are 2 ends, anterior end and posterior end, 3 borders, superior, intermediate and inferior, 2 surface, diaphragmatic surface and visceral surface. So in this picture, you can be able to see it clearly. This is the anterior end. Anterior end is somewhat broader than the posterior end. This is the posterior end. And then we have 3 surface: superior surface, intermediate surface, inferior surface. In the superior surface, notches are presented. Okay, superior border. In superior border, notches are presented. And we have diaphragmatic surface and visceral surface. This is related to the diaphragm. This is related to some of the organs which is related to the spleen. So coming to the relations, while we are speaking about the relations, we have to speak about the 2 things. One is peritoneal relation and second is the visceral relations. Coming to the peritoneal relations, so this is the spleen. So we have two ligaments around the spleen: lienorenal ligament, gastrosplenic ligament. So in gastrosplenic, this is the stomach, this is the kidney. So kidney is related to the spleen by lienorenal ligament. Stomach is related to the spleen by gastrosplenic ligament. Okay, and there are some of the lymph nodes also presented. So this is all about the peritoneal relations of the spleen. Coming to the visceral relations, so this is the spleen: superior border, intermediate border, inferior border, posterior end, anterior end. These are the features, external features. So coming to the visceral relations of the spleen, this area is totally involved, or the organ which is attached here is the stomach. So gastric impression. Here it is fully attached by the kidney, renal impression. Here colic impression, here pancreatic impression. These are the visceral relations of the spleen. What are the visceral organs are related to the spleen? Stomach, kidney, colon, pancreas. So these are the impressions which is presented in the spleen. Coming to the blood supply. Splenic artery is the main artery which supplies the blood to the spleen. So splenic artery is a branch of celiac trunk. Coming to the venous drainage, splenic vein is involved. So what are the tributaries, which includes short gastric vein, pancreatic veins, inferior mesenteric veins, and left gastroepibloic veins. So these are the veins which is mainly involved around the spleen, venous drainage. Okay. So coming to the clinical aspect, we have splenomegaly, splenectomy, rupture of spleen. Splenomegaly with something when the spleen gets enlarged and that is referred as the splenomegaly. So this is the normal spleen. This is the enlarged spleen. So this is referred as the splenomegaly. So coming to the splenectomy, see, the spleen is occupied in the stomach area. Okay, so this spleen is removed. See, the spleen is removed, which is the surgical removal of the spleen is referred as splenectomy. And coming to the ruptured spleen. Ruptured spleen in the sense the epithelium or the organ itself get damaged due to the rupture of the other organs around it. So during this rupture of the spleen, splenectomy will be performed. In the sense, removal of spleen will be taking place. So when there is rupture of the spleen, there will be pain in the left shoulder, which is referred as the curse sign. Okay. So these are the clinical importance of the spleen. Thank you.